Good morning and welcome back to Kirk in the Morning. Of course, as mentioned earlier on, today our focus or the health dialogue that we are having today is, of course, on matters to do with sickle cell disease. In studio, I am with that is Dr. Deborah, who is a hematologist or pediatric hematologist and oncologist. And we also have Millicent Manga, who is a sickle cell warrior and advocate. And together we'll just be unveiling sickle cell disease. Remember, that is on 19th of June. The world marks World Sickle Cell Awareness Day. And of course, for this year, the theme is bridging the gaps towards optimum care and control of sickle cell disease. As mentioned, still, we are coming to you live. That's on Facebook as well as YouTube. So feel free to ask any question or a comment. That is via the comment section. Of course, you can also send an SMS via our SMS number. That is 0111 220044. Be part of this conversation, and of course, together, let us learn about sickle cell disease. And Dr. we just start with you. Just feel free to introduce yourself to our audience.
Yes, my name is Dr. Deborah Omedo. I'm a pediatric hematologist and oncologist. I work at Kisii Teaching and Referral Hospital, and I'm happy to be with you today.
You're right. We're also happy to be with you, Millicent.
Good morning. My name is Millicent Manga. I'm a sickle cell warrior and a sickle cell advocate. I live in Nairobi.
All right, and I'm also glad to be with you, and of course we are looking forward to learn from both of you as far as the sickle cell disease is concerned. And Dr. we just start with you. For someone who is, of course, just hearing of sickle cell disease for the first time, or someone that has heard of the disease but they basically do not have an understanding of what it is, just help us understand first what sickle cell disease is.
All right, thank you. So sickle cell disease is an inherited disease that one gets a gene from the mother and a gene from the father. Now this sickle cell disease makes the red blood cells be shaped differently. Instead of being shaped round, they are shaped like a sickle. That means they are crescent shaped. They are shaped like this. They are sharp. Instead of being nice and round like this, they are now shaped and they are very sharp. They scratch the insides of the blood vessels. They break down easily. For someone who doesn't have sickle cell, the red blood cells are round and they are able to flow in the blood vessels very easily. They usually stay for about 3 months within the blood vessels, and then the bone marrow renews them. But when you have sickle cell, the shape of the red blood cell is distorted. It is sharp and they are sticky. So they easily scratch the inside of the blood vessels. They easily break down. They can break down every 10 days instead of every 3 months. And when they break down, they release a yellow substance that can cause yellowing of the eyes or even of the urine. And when they stick together, the blood doesn't flow properly. And now when the blood doesn't flow properly, it means oxygen cannot reach the different cells in the body. And it becomes very painful because now as the blood is trying to force its way and there's a blockage, the person will feel so much pain in their bones and in every part of their body. And that is what now causes all the acute and chronic complications of sickle cell. Yes.
All right. And there is, of course, sickle cell disease and sickle cell anemia.
Yes.
Is it one and the same thing, or is there a difference?
Yes, I think it's one and the same thing.
All right.
So when you have sickle cell, it means the hemoglobin, that is the red thing in the blood cells, it means that there's a mutation, meaning it's not the normal way it's supposed to be, and that's because you've inherited one S gene from your parent. So if both your parents are carriers, you might get one S gene from your mother and you can get one S gene from your father. So that means now you get sickle cell, and that means your red blood cells will be distorted. Yes, yes,
right.
Yes.
Okay. And of course, thank you for explaining that, and I hope that we've understand in the most basic way.
Yes.
And now to you, Millicent. Of course, Dr. has shared that it is an inherited disease. So just let us know, of course, when did you know that you had sickle cell, and how was it even with your parents?
When I was born, I used to be sick most of the time, and like my other siblings, we are the firstborn in a family of 3. And so I used to be sick each and every time, but it was not known before back then.
Okay.
Now the doctors used to treat me malaria until one day I met with another doctor at Kisii Teaching and Referral Hospital. He sent me to Kenyatta National Hospital so that they can come and carry out the sickle cell test, the genotype test.
Okay.
So I came to Kenyatta Hospital when I was 12 years, and that is when they discovered that I have sickle cell anemia. But personally, my both parents don't have sickle cell anemia. Yeah, I'm the only person who got sickle cell.
That's in your family.
Yeah.
All right. And what would you say are some of the signs that you used to experience even before the doctors told you that you had sickle cell disease?
Some of the signs I used to explain mostly was pain. My joints used to be painful, and I used to have a stunted growth. I never used to grow. Then my eyes used to be yellow most of the time, and I used to feel weak each and every time. I'm just tired. Yeah.
All right. And Dr. of course, before we get to the diagnosis, let us just look at Millicent's case.
Yes.
Of course, when it comes to treatment and the signs that she used to show, of course, she was being treated of malaria. Are there cases, similar cases, or do the signs that is for malaria and of course for sickle cell, do they like mimic each other?
Yes. Thank you for the question. So one thing we need to do as a country is to have universal screening for sickle cell. So in most advanced countries, when any child is born, they are immediately screened and to check for sickle cell. And if they have sickle cell, the child is now put in the clinic and followed up, instead of waiting for the child to get sick and get symptoms. So as she had said, one of the symptoms that she felt was feeling weak. And the reason she was feeling weak is because the red blood cells were getting destroyed. And that now what causes anemia, meaning you don't have enough red blood cells in your body. And so that weakness was because the red blood cells are getting destroyed very quickly in the body. Instead of staying for 3 months as usual and then getting renewed by the bone marrow, they were now getting destroyed like even in less than 10 days. And then when they get destroyed, there's that yellowness of the eyes or yellowness of the urine. Because that pigment that's supposed to be in the red blood cells now comes out. Yes, and so then also when these cells, we say they are sticky, so they might stick and block the blood vessels. So now as the blood is trying to flow, the blood is not passing through, and now that causes a lot of pain, and that's why she was in pain during that time. Yes, and so when the disease is diagnosed early, there are some treatments that we can give that now reduce the pain that the patient will get. So one of the important treatments that we give is a drug called hydroxyurea. Now this hydroxyurea does something very special. When all of us are in our mother's stomach, we have our hemoglobin type is type F, F for fetus. And when you look at the blood cells of a very small baby or a baby in the mother's stomach, they are large, they are big, huge and round blood vessels. But as we grow, as we are born and then we reach 2 months, 3 months, 4 months, this HbF disappears. And then that's when, if you don't have sickle cell, you have HbA. If you have sickle cell, now you have HbS. Now, when a person with sickle cell is given this medicine called hydroxyurea at the right dose, hydroxyurea helps the HbF to come back. And now when it comes back, instead of the cells being shaped crookedly and sharp and causing so much pain, they become round again. They become round again and round and big, so that now the complications of sickle cell are reduced. So they don't break down as quickly as when the sickle cell is alone without any medication. And now they're able to provide enough oxygen to all parts of the body. But now if you stop the hydroxyurea, the F goes back down and the S comes back again, and then now the cells will begin to become abnormal again. So it's very important to be able to get the hydroxyurea daily and at the right dose. The dose is never the same. Every person's dose is different. The dose depends on the symptoms of the patient. The dose depends on the weight of the patient and also on the full hemogram. There are some things we look at when we're looking at the full hemogram. That is a blood test that is done in most of the hospitals in Kenya. We look at the white blood cells. We would like them to be at a certain level. We look at the neutrophil count. We like them to be at a certain level. We look at the MCV. MCV tells us the size of the shape of the red blood cells. We want it to be as big as possible because we don't want it to be thin and that. And we look at the platelets. So those guide us to make sure that we adjust the dose. And that means that people with sickle cell need frequent clinic visits so that these adjustments can be made in good time. And when the adjustments are made in good time and the cells now remain nice and round, you find that now the complications of sickle cell, like the pain, the yellowness of the eyes, the damage to the different organs can be minimized. Yes.
Right, and I can see, Millicent, just the way you're nodding, it shows of your knowledge, of course, when it comes to sickle cell, and even as you've grown by, of course, you're now an advocate of the same, and of course, a warrior, as you like to refer to yourself. When you were told that, of course, or when your parents were told that you had sickle cell, did you have an understanding of it, or that was something totally new, of course, to yourself and to your parents?
Okay, first of all, I used to live with my grandmother back at home. So whenever I used to go to hospital, even when I was sent to Kenyatta, we were with her. So the counselor, when the doctors carry out the test and it turns out positive, you're referred to a counselor who makes you understand better or have good knowledge about the condition. Now, I think personally, I didn't get a good counselor because back then, sickle cell was not something that people knew. Like currently, we are advocating, we are creating awareness. So my counselor used to tell me, oh, you know, people living with sickle cell, they don't go past 18 years. When you are 14 years, there are high chances of a person dying. And so we were just like, what can this disease be? Now, my grandmother just took it as a normal disease, just like any other diseases. Even me, I didn't bother. So when I was schooling, the only thing I used to see is that I was treated very different from other children because whenever you are with sickle cell, there are some things that the doctor advises you not to do, those exercises that makes you to get tired more easily. Now I was not allowed even to go for games, and I was not allowed to play football. Now I was being limited. Now after school, because when I was in high school, I used to face stigma because the students never understood. They will just come and laugh at me. I was the only person who was taking medicines each and every time they could see me. Now they used to say maybe she's suffering from AIDS because they just knew someone who is suffering from AIDS is the only person who is under medication each and every time. Now I faced the stigma and even the teachers, but okay, they understood, but not that much. Now when I grew up after high school, after facing all the stigma and everything, I came and I joined college. I pursued, when I wanted to take a course in nursing, but I started doing research about sickle cell. So the only thing I used to say is someone needs to eat good, vegetables, water. Now I decided to pursue a course in nutrition and dietetics so that I can personally know how to take good care of myself, because I used to know this is something that I will just get well. Now when I went to pursue nutrition, that's when I started to gain interest about sickle cell, doing more research. Now that is when I started understanding. But after high school in 2016, it's when I started to live with my parents. Back at home, they used to receive phone calls, say, your daughter is sick. They just knew it's just sickness.
So for them, they also did not understand.
Yeah,
sickle
they
cell.
didn't understand. Now, when I started living with my parents in 2018, I got a very bad crisis. The sickle cell pains are called crisis pains. Now I got a very bad crisis. I was my liver. My liver failed. Now I became worse, and my parents have never seen me in crisis. Now they were shocked. You can hear my mother calling my grandma, oh, she's sick, what can we do? Now when I was admitted in Kenyatta, I was admitted for around 8 months to 1 year. Because the crisis was not going away, they used to do a lot of transfusions and Magi, the NS. Now that is when my parents were called with the doctors at Kenyatta. They were explained and taught about sickle cell, how they should treat me, how they should handle me. That's when they started understanding what sickle cell really is. Yeah.
Wow, and of course you also have quite a great understanding of the condition, even as you speak and share your journey.
Yeah.
And now Daktari Millicent has shared of some of her organs, of course, also being affected.
Yes.
She's mentioned of her liver.
Yes.
What causes this, and what are some other organs in the body that can be affected when someone has sickle cell?
Yes. So as we said earlier, in sickle cell, the red blood cells are shaped differently. So they become sticky. They block the red blood cells, the blood from flowing properly. And so if the blood is not flowing properly to the brain, you can get a stroke. If the blood is not flowing properly in the retina where that helps us see, you can have eye problems. If the blood is not flowing properly to the kidneys, you can get kidney injury. And for like her case, the blood was not flowing properly to the liver, you can get acute liver failure. You can even get gallbladder stones, because when the red blood cells break down, that yellow pigment can sometimes form stones inside the gallbladder near the liver. So sickle cell can actually affect any part of the body. Yeah, and that is why it is very important to make the diagnosis early, and it's very important to be on the daily medications. I talked about the first medication, which is hydroxyurea. Then the other second very important medication is penicillin V. Penicillin V helps to prevent infections. You see, in our body, we have an organ called the spleen, and the spleen usually helps us to fight many bacterial infections. Unfortunately, in sickle cell, because the spleen is so busy trying to get rid of the badly shaped red blood cells, it's now unable to fight the diseases properly. And so that means if you get a bacterial infection, you can easily become sick. So if a person with sickle cell takes penicillin V every morning and every evening, it helps to fight any bacterial infection. A long time it was thought that you should stop taking the penicillin V when you reach 5 years, but later on it has been found that even the benefits of penicillin V go beyond 5 years of age. So that's a second drug that someone with sickle cell needs to take every day to prevent bacterial infections. Then the third drug that is very important is folic acid. When the red cells break down, the folic acid is lost in urine. And folic acid is important in the building of the red blood cells in the body. And the red blood cells are so important because they're the ones that carry oxygen to all parts of the body. And so so folic acid helps replaces you need to take folic acid to replace the folic acid that is lost in the cells. And folic acid is also found in fruits and vegetables, especially the colored vegetables and the green vegetables. And so it is very important for someone with sickle cell to take folic acid once a day. It's just one tablet once a day. The dose does not change much. Then the fourth drug that's very important as well is proguanil. Proguanil is a drug that helps to prevent malaria, and it also helps to prevent the spleen from becoming too big. Some people with sickle cell, for some reason or other, the spleen can become so big and all the blood gets stuck in the spleen, and it's a very dangerous situation. So proguanil does two things: prevents malaria and also prevents the spleen from becoming very big. So usually if someone with sickle cell takes those 4 drugs on a daily basis, and goes to clinic at least once a month or at least once every 2 months to have the doses adjusted according to their weight, they can do well. The complications can be minimized. Yes, it's not a cure, but it can be able to control the disease. Yes, yeah. And then when there is a crisis, as she had talked about, when there's very severe pain or a very severe illness, it is very important that someone with sickle cell be taken to hospital straight away. Sometimes they may need oxygen, because usually the cells break down and become badly shaped when oxygen is low. So they can be put on oxygen, and they can be put on drip, what you're calling a normal saline drip, a drip that will now help the blood to flow better. You remember there's a blockage in the blood vessels. So when you get the drip, it helps the blood to flow better. Sometimes the blood can be very low, and that you may need a blood transfusion. And so it's very important for us who are well to be able to donate blood on a regular basis, so that those who are suffering from sickle cell and need blood, they are able to get it when they need it best. Yes, yeah. So it is very, very important for people living with sickle cell to have National Health Insurance Fund, NHIF, because that when you have NHIF and you go to the hospital, you will not have to pay the bill by cash. You find at least it can pay for the bed for most hospitals in the country. And if the hospital is well stocked with drugs, many of the drugs will be free. And if you need to do tests like an X-ray or a CT scan, or you need an ambulance to transfer you to another hospital, NHIF usually assists most patients with that. Yes.
Right. Just to take you back,
Yes.
Daktari, Millicent mentioned that is the one in your family, and also she mentioned that the parents also, none of the parents has, and you just, as you explained, of course, with the genes, if one parent is the carrier, of course they can pass it down to the child. How exactly does that happen, especially if your parents are not carriers?
Yes.
Yeah.
All right. So it is very likely that both Millicent's parents are sickle cell carriers. And sickle cell carriers carry the normal gene, the normal hemoglobin gene, which is A, but they also carry this abnormal sickle cell gene that is S. Usually most carriers do not have symptoms. They live a normal life and they just feel fine. They don't feel sick at all. They usually have a very normal life. Although there are few sickle cell carriers who get symptoms of sickle cell. Yeah, so we should always remember them as well, because some of them also have the same symptoms as sickle cell and need treatment. But most carriers do not have any symptom at all. They live a normal life. So when two carriers marry, they have a 25% chance of getting a child who is completely normal with AA. All right. Then they have a 50% chance of getting a child who is like them, who is a carrier like them. Okay. And then they also have a 25% chance of getting a child who has sickle cell. And this chance is with every pregnancy. So with each pregnancy, you might either get a sickler, or you get a carrier, or you get a person who doesn't have sickle cell at all. Yes. So you cannot predict how it will be. All the children can have sickle cell. All the children can be carriers. All the children can be completely normal, or you can have a mixture. You can have a mixture, so you cannot predict it. Yes, and that is why it's important for everyone to know their sickle cell status, because you might be a carrier and you don't know, so it's always good. You can even be having sickle cell and you really don't know. We've had people living with sickle cell who have known they have sickle cell only when they were adults. Yeah, so it's very important to get the test. Everybody should be able to get the test. We urge government to make sure that everybody can be screened. We urge government to make sure that the tests can be done in every hospital and at an affordable price, so that people can know their status. They can know their sickle cell status, and if they have a sickle cell, they're able to start clinic early enough. When they are getting married, they can make an informed choice. It doesn't mean that you don't marry because now you're both carriers, but it means that when you marry, you know you might get a child who has sickle cell. So you make sure you test your children early enough and put them in clinic early enough, rather than waiting until they are sick or they get any complications. Yes.
Right. And now for the, of course, for the parents.
Yes.
And the tests that you've mentioned, are the tests like available in Kenyan hospital? And how is it to the public? Is the public aware of this? And do people come to you, experts, for such tests?
Yes. So sickle cell can be tested in many different ways. So one of the most basic tests is called sickling test. So it's a test where the blood is taken and they look at it and they find the cells sickled, and then you know it is positive. And it is a good test, and if it is positive, then we treat as sickle cell. Then there is also another test called peripheral blood film, where the blood is put on a glass, just like the way we check for malaria. And then the person looks in the microscope, and if the person sees the sickled cells, then they know for sure that there is sickle cell. But now there are what she called the genotypic tests, which are like more accurate, which now actually tell the exact type of sickle, because there are some different types of sickle cell. There are people with SS, there's some people with SC, there's some people with even SD, and many different types of sickle cell. So the genotypic test is good because it tells you exactly which type of sickle cell you have. So these tests are like HB electrophoresis, and nowadays there's even the high profile liquid chromatography test. So and then also they are now rapid test kits where you test like for HIV, just a drop of blood, and in 10 minutes you know your sickle cell status as well. Yes. So unfortunately, the genotypic tests have not been readily available in most hospitals, which is very unfortunate. So many times people are forced to go to some private hospitals, and sometimes it's very expensive. You might find it's 5,000, 6,000, 7,000, 8,000 shillings, which most Kenyan people cannot afford easily. So it is, to me, I would urge government and Kenyans as a whole to lobby to make sure that these genotypic tests are available in every hospital, and that screening can be done at birth for every child who is born. And even the rapid test kits are readily available, so that anyone who needs to know their status, the way we are easily able to know our HIV status, we should all be able to know our hemoglobin status, to know whether we are carriers or we are not carriers, or whether we have the sickle cell disease itself. Yes. So regardless of the different tests that you have done, once sickle cell is found, it is important to enroll in clinic and to be able to start these drugs and to have regular follow-up. And then for people who work in the emergency rooms in various hospitals, when the person comes with a sickle cell crisis, it's an emergency. Don't make that person queue for very long on the line. Please bring them forward. Put them on oxygen if they need the oxygen. Get an IV line and give them the painkillers, give them the oxygen, give them the drip, so that they can get better quickly. When a crisis is handled very well, very quickly, it doesn't last a long time. But when it is mishandled and the person is in pain and the pain is not solved properly, it's not given the right strong painkillers that they're supposed to get, then now the pain can even become chronic, and the patient can get so many unnecessary complications. So as health workers, we need to work hard to make sure all health workers know how to handle sickle cell, so that when they meet the case, they are able to diagnose it and to be able to give that person prompt treatment, prompt emergency treatment, so that they do not get the complications of sickle cell. Yes.
Right. Millicent, how has your experience been when it comes to the caregivers, of course, in hospitals, especially when you're now undergoing through a crisis?
At some point, I can't complain much, but the care has not been that good. You know, there are some hospitals with sickle cell, you can't predict. You can't see the signs that now the crisis is coming. I can just be on my way to work and then the crisis just comes. So you have to rush to the nearest hospital. Now there are some hospitals you go, maybe you find they don't have any experience with sickle cell. Now they are like, whenever you are in pain, what do you do?
So they ask you.
Yeah, they ask you, or you just see a doctor, a nurse takes out his or her phone to Google. And there are some hospitals, when you go, you are in pain, they just shout at you, hey, you are not the only patient. We have so many people here. And then they just come give you like Panadol, the IV. They just give you, and you are like, no, whenever I'm in pain, maybe I'm being given, there are some strong painkillers like morphine, pethidine. Those are the ones I use. And then you get some health workers don't want you to tell them. They take, yeah, maybe they think you're dictating them. Now there are some hospitals, they just mishandle you. Yeah, and there are some hospitals where you, personally, I always say, maybe you get an angel. That's what we call them. But when you go to various hospitals, most of the public hospitals, they are not serious. They are not. They don't have that concern. Like they are not quick. No, they will just treat you as a normal person. And I have friends, you get them being mishandled, and then the pain can't stop, it continues. And there is an extent where when you have a lot of pain, it can also lead into death in some cases. Yeah.
So how do you deal with this? How do you deal with such? Of course, there are so many challenges when it comes to the person, of course, living with sickle cell. How do you just go about these challenges?
So far, so good. Some of the challenges that I have faced. Number one, I used to have low self-esteem. You know, when I'm with friends, okay, most friends don't understand this sickle cell. Now people tend to take you're lazy, because most of the time you're just tired, you're weak, you just need to rest, drink water. Now they just take you as a person who is very lazy, and it's not that you are lazy, it is how your body is. That is one of the challenges, and that leads you to have a low self-esteem. You don't even love yourself. You each and every time you're just there comparing yourself with other people. I wish I could be, I wish I could do this, I wish. There are so many wishes. Another challenge that I have faced is when you're going to look for work or when you are employed. As I said early, the sickle cell crisis, the pain doesn't show you any sign. Like personally, this moment I'm very much okay. I can just live here and the next minute you will see me just in crisis. Now, so many employers don't understand this sickle cell. Now each and every time you take sick offs, they are like, you are lazy, you can't meet our targets. Now you find so many people living with sickle cell are unemployed because so many people don't understand them. Again, you find people with sickle cell that don't love themselves, even in school, but they are very hardworking. But now, personally, when I was in school, whenever I strained so much concentrating, I used to get headaches. It got to an extent, I used to go to my clinic and complain to my doctor because the headaches were being persistent. Even I used to reach a point where I completely forget where I am. I just sit. Now, whenever you strain so much, you get that crisis. And if you can't be with someone who really understands you, they will get tired. Yeah, so that is another challenge that we have faced. Another challenge is when it comes to our health insurances. You find there are so many health insurances out there, but when you go to find one like Jubilee, AAR, they tell you can just apply and wait for a period of 1 year. Like they don't help someone as much with pre-existing conditions, even NHIF. And then you go to some of the hospitals nowadays, you even pay for transfusions. The NHIF doesn't cover the transfusions, so they just cover the bed, maybe the drips. And there are some hospitals, they are well stocked, but some painkillers like morphine, pethidine, you have to pay cash. The NHIF doesn't pay for that. So those are some of the challenges. But personally, whenever I got to a point and I said no, now the low self-esteem, I don't want to be in that state anymore. I have to love myself, because healing comes from you as an individual. So I started understanding myself. I started to handle myself first with care. Personally, whenever I feel pain, even wherever I walk, I have to carry some painkillers. When we go to the clinic, to hospital, apart from the medicine that Dr. mentioned, the daily like hydroxyurea, zinc, and folic, we are given some painkillers in case you get pain and you are not near hospital. You can take the painkillers first, and if they don't work, that's when you proceed to go to hospital. Now personally, I work with painkillers, and when I understood my condition, there are things that we are taught in clinic, like drinking water. So most of the time you'll get me drinking water to hydrate. Now when you drink water and you eat well, you eat so many vegetables, you eat balanced meals, you don't get the frequent clinics. And then there are things that may trigger the pain. There are some people who can't play football, but personally I play. With sickle cell patients are not the same. The pain I can experience is not the pain my friend can experience, because our bodies are very different. Even the drug that can work for me is not the drug that can work for someone else. So personally, I think I do so many heavy things, like and like how we are being warned. So when you are in high temperatures or low temperatures, someone experiences that attack, the crisis attack. Now I think with the sickle cell patients, what we need to do, like personally, it's understanding yourself. Just know some of the triggers that can trigger the pain and avoid that. That is what I do. And then, you know, when you grow, you're being told maybe that's you are that disease is witchcraft. You know, maybe there's something that you did for a person and it's a curse. So many people tend to call it curses. Even in your family, even your immediate families, you find people, they don't really understand this sickle cell, that it is something that is genetic. You find so many people telling you, let's go for prayers. You don't pray a lot. You are not very spiritual. That's why you get sick. But that is not the case. Now, so those are some of the things that we face. But when you understand yourself and know how to take good care of yourself with the help of your doctors and your family, you are good to go. You just live a normal life.
Wow, thank you so much for that. And Dr. Even as Millicent speaks of the myths and the misconceptions, of course, with a condition that someone doesn't understand, stigma is then associated with this particular condition. And earlier on, Millicent mentioned of the issue of age, where even the counselor told her that she won't be able to live past the age of 14, past the age of 18. What are some of the myths from where you sit as an expert? What are some of the myths and what's the facts about sickle cell disease?
Okay. So it is very, very unfortunate that she had to get such negative news from the counselor. The thing is that if sickle cell is handled well, one can live a full life. We know a Nigerian lady who died at 93 years, and she had sickle cell all her life. In Nyamira County, we have one of people living with sickle cell. He's now 73 years old, and he's doing well. He has one daughter with sickle cell. He has other children who don't have sickle cell, and he has lived his full life. So, like any other disease, one needs to just take care well. To me, I believe there's a lot of hope, but there's also a lot that we need to do. Number one, we need to make sure everyone is screened at birth, so that now you know your status early on. Then we need to make comprehensive clinics in all over the country and sensitize all health workers on how to manage sickle cell. so that during the crisis, people are handled well. And even in the routine clinic, the drug adjustments are made correctly at the right time. Yes, and if we do that, the people can live a fairly normal life, and they can achieve great things. We have people living with sickle cell who are CEOs, who are doctors, who are nurses, who have achieved great things even in their careers. And we believe that sickle cell doesn't have to be a death sentence. Sickle cell doesn't have is not a curse. If it is understood well and handled well, then it can go very well. So what we need is for government to make sure that the way of diagnosing is available everywhere, and that there are all health workers are sensitized on how to handle it properly, and especially the adjustment of the hydroxyurea dosage. Because when it is when you do your full hemogram, you can tell here there might be a crisis, and instead of waiting for the child to have the crisis, you're able to adjust the drug. And when you adjust the drug in good time, now that patient will not have that terrible crisis that they could have had. And so that is what that is my mission. I try to make sure in every forum that I get of doctors to try to teach them how to make the adjustment of the hydroxyurea properly. Unfortunately, sometimes for some cases, the patient has already gone through some very serious complications like stroke, or the bones, especially in the hips, maybe may have been affected. Something we call avascular necrosis and all that. And sometimes with such severe complications, sometimes there may be need to do stem cell transplant to prevent further complications from taking place. And so. So far in our country, we had not started, but people are gearing up towards the same. Of course, stem cell transplant has its own dangers, because the person has to be given chemotherapy and the immunity can go very low, and then they're given the stem cell transplants of maybe a relative who has a similar HLA type like them. For those who are successful, they do well. But sometimes it can be unsuccessful, and there can be some complications. So it's not just done for anybody. So if someone is under good control under the hydroxyurea, not getting more than 2 very bad crises in a year, then maybe stem cell is not for them. But there's those who get very bad complications despite trying to optimize the drug as well as possible. For them now, stem cell can be one of the solutions. Then the other solutions that are still under research is gene therapy. So a few cases have been resolved, but it's still under research, and so it's not yet available. There are some newer drugs that are given as a drip. There are some clinical trials still running in our country, and we are waiting to see the results of those. Unfortunately, they've been available mostly for the adults and older teenagers. Not very many of them have been there for children. But hydroxyurea, at least it can be used from children. Usually they start from 9 months of age, but sometimes if a child is symptomatic even before they have reached 9 months of age, with a good clinic follow-up, you can even start earlier. Now, another unfortunate thing in our country is that the hydroxyurea has only been produced as an adult capsule. And we know many children cannot swallow a capsule. We know that even a person who has a stroke will not be able to swallow a capsule very easily. So we need our drug companies, we need to challenge our drug companies to make a dispersible tablet and to make syrups that can be available for the small children. So what we have done in our hospitals is our pharmacists sometimes convert the capsules into a syrup that the child can take. But it would be good that if the manufacturers could do that from the factory level, so that the drugs are readily available in syrup form or in tablet form that is easy, especially for the children. So that when they grow up, they can now take the capsules when they're now able to swallow properly. So there's a lot of work that needs to be done. And to me, I think the future is bright. If we work on these things, we can now diagnose sickle cell early enough, we can put the right treatment in good time, and people can live a good and healthy, long life that is productive with minimal complications. And for those who have already undergone complications like the stroke or even the vascular necrosis, not all hope is gone. There can be rehabilitation. You can put now the drugs at the correct dosing so that you prevent future complications. And even with those complications that you have, there can be physiotherapy, there can be occupational therapy, there can be control of the convulsions if they are there can be nutrition therapy, and you can work with the orthopedic surgeons to do sometimes hip replacements and all that, so that now you can be rehabilitated even though you had gone through complications. And we have seen some children who have had terrible strokes could not talk, could not walk, but with good rehabilitation, they are back again, and they have bounced back again, and they are doing very well. So to me, I know there is hope in sickle cell. All we need to do is to be organized as a country, make sure that our hospitals are working well and efficiently, the drugs are available at all times, we train the medical people how to adjust the drugs correctly, and you can live with sickle cell with hope, with courage, and be amazing. And instead of having and they turn the sickles into smiles, and so that everyone can come to the clinic happy and productive, going to school well and doing their work properly. Yes.
All right. And thank you so much. I think we will be taking a very short break. Of course, when we come back, we'll just be looking more, of course, even as Daktari tries to bring up the management, of course, and prevention bit of sickle cell disease. We are looking at sickle cell disease. Remember, June 19th, the world marks out, that is a World Sickle Cell Day. Of course, when we come back, we'll just be looking more into the theme of this year. So we take a very short break. When we come back, we will be looking more as far as sickle cell disease is concerned.